Chemotherapy puts cancer patients through the wringer, but light may help them avoid some of the side effects. Find out how this week on Light Matters. This is Light Matters for July 15th, 2015. I'm your host, James Lowe. This week, we look at how light could help detect disease and make chemotherapy easier on patients. We'll also learn about an unexpected light show under the sea. But first, we'll go to the high desert of New Mexico to see how a tunnel full of water vapor is helping advance optical design. Fog limits the range and resolution of cameras in any application, but gathering hard data on fog in the field is tricky because it can't be controlled. Now, inside a 180-foot-long chamber, scientists at Sandia National Laboratories can create fog to order, even adjusting the size of mist particles to resemble real fog found in coastal or inland environments. In the future, the facility may be used to test optics and cameras against smoke and airborne dust. According to Sandia, the chamber could be used to answer fundamental optics questions, which in time could lead to improved security camera lenses and medical imaging equipment, safer aircraft landings, and better vision for drivers in fog. Now we go underwater, where a newly discovered species of coral have been leaving the light on. Photonic Spectra editor Justine Murphy has more.
Found in the Red Sea near Israel, the corals live more than 50 meters below the water's surface, where not much sunlight penetrates. Yet they fluoresce in colors ranging from green to yellow to red. That's a broader spectrum than that found in shallow water corals, in which the production of pigment is controlled by the amount and color of the light that shines on them. In the deep water corals, pigment production appears to be independent of light exposure, though some of the pigments do require violet light to switch from green to red. More study is needed, but researchers at the University of Southampton in England think fluorescent pigments from the deep water corals could be of use in bioimaging applications. The research was published in PLOS One.
Thanks, Justine. After the break, light sniffs out disease and makes chemotherapy easier on patients. Stay with us.
My name's Susanne. I'm a product manager at Greentech, which is a Swiss-based company that produces thermal laser power detectors. If you want to find out more about our products, have questions or ideas on how to use them, please visit us on our webpage greentech.com and just ask your questions. We will be happy to find a solution for you. Thank you.
Welcome back. Next we go to Australia, where work is underway on a frequency comb spectrometer that could help clinicians detect disease just by analyzing the air patients exhale. Using a variable length Fabry-Perot filter cavity, the device measures the infrared absorption spectra of different molecules given off as byproducts of diabetes, infections, and cancers. According to researchers at the University of Adelaide, this method could enable non-invasive detection of disease even before the onset of external symptoms. The researchers hope to commercialize the device in 3 to 5 years. Their work was published in Optics Express. And now we go from detecting disease to treating it. Biophotonics editor Rod Pedrati has this story about a new light-based technique that could be a boon to cancer patients undergoing chemotherapy.
Many of the most successful and widely used chemotherapy drugs interfere with the function of microtubules, which are the skeletal components of cells that play a key role in cells' ability to survive and multiply. This sounds ideal for battling cancer. However, these drugs can't differentiate between cancerous cells and healthy cells. So the drugs affect normal cells too and lead to adverse side effects like heart and nerve damage. A team from Ludwig Maximilian University of Munich has developed a way to optically control these drugs. Structural elements in the drugs are replaced with compounds called photostatins, which act like hinges that allow the drugs to be turned on or off in response to blue light. In effect, the drugs essentially can be activated or switched off with single-cell precision, so cancerous cells only can be targeted and healthy tissue can remain unaffected. The researchers believe that in future clinical settings, patients could wear blue-tinted glasses to treat eye cancer, while individuals with skin cancer could wear a bandage that delivers light to tumors. Additionally, internal tumors might be treated with an implantable network of LEDs that blink every few minutes in order to maintain the chemotherapeutic effect in the enclosed tumor site. The research was published in the journal Cell.
Thanks, Rod. And that's it for this week's show. To receive a weekly alert about upcoming Light Matters episodes and more great video content coming to photonics.com, visit photonics.com/subscribe and check Light Matters Weekly Alert. Thanks for watching, and we'll see you next week.